Hello everyone, good morning, good afternoon, and good evening. Welcome to Live It Up, the show where we explore and discuss how to take your life to that next level and beyond. We cover health, wealth, relationships, and how to create a life you absolutely love. I'm your host and coach, Fletcher Ellingson. Amy will be joining us after the commercial break. Today, she and I are going to be talking about some pretty cool things. There's going to be a lot of interesting and surprising information for you as we talk about oral hygiene. Wait, before you change the channel, because I know what you're thinking. Oh my gosh, how uninteresting, how boring, oral hygiene. Just hold on, because I've got to tell you, I've heard some of what she's going to be sharing with us, and it's pretty cool stuff, honestly. And besides, remember, health is the first wealth, so stick around for the answers, okay? We're going to get to today's email, but before we get to that, I want to remind you that if you have questions that you would like us to answer on or off the air, you can email them directly to me at fletcher@fletcherellingson.com. If you're feeling stuck in an area of your life, whether it's financially or in your health or in your relationships, get in action. Reach out to us. You don't need to suffer. There are answers and there are solutions and there are ways to get unstuck and move forward powerfully. All right, let's get to today's question. It says, Dear Fletcher, I am a musician. I play guitar and piano and I like to sing. It's one of my favorite things to do. I'm pretty good and can play and sing along with most of the music I listen to. I've even written some songs and they sound really good. But the thing is that I am terrified at performing in front of people. When I do perform, I begin missing notes, I mess up my timing, and I don't sound good at all. I haven't played in front of anyone in almost 2 years. I enjoy making music and I want to sing the songs I write in front of the world, but I can't seem to shake off what is becoming a really big deal. Signed, Danny. Hey, Danny, first of all, thanks for reaching out. As I always say, strong people ask for help, and that's you. All right, let's recap this and then break it down for you. So what I hear you saying is that you love to play music. You're good at it, it brings you joy, and you'd like to even share your music with the world, but it sounds like you've got some anxiety around performing, stage fright or performance anxiety. And sounds like it's kept you from performing for the past couple years. And so what is there to do about it? Well, let me first of all say, I totally get that. I want to tell you a little bit about what happened to me a number of times. I think I've shared on this show before that I love performing magic. And there have been several times in my life where I was scared, just unbelievably scared to perform. And I remember the first time that I went down to Pike Place Market in Seattle, and because I would perform on the streets there. But the first, couple times that I went down there to perform, oh my gosh, I was pacing back and forth, kind of looking for a good place to set up my table. And then when I finally set it up, I was like, oh my gosh, I was so scared to get out my cards, and because I didn't know how to attract an audience at that point. I didn't know how to engage those people. And what if I messed up? Because I was already scared. So once I got my cards out or my coins or my rubber bands or whatever my props were, my hands were shaking. So how was I going to even perform? But I began doing that, and I got better and better and better. And I'm going to tell you in a minute how I got through that. Then I was in college, and I remember putting together a brand new opening act for my show. And I have to tell you, I felt so unprepared. I just felt grossly unprepared to do this. And I wanted to do it so badly. And I remember getting up there and hitting play on my music, and I went out on the stage with this brand new act, and it just flopped. It flopped big time. People were smiling because they knew me in the audience, but they were just kind of they knew it was going badly and they were still being friendly. And then finally, many years later, I was doing a magic show at Campbell's Resort for a group of people, and again, I was trying a brand new bit of magic, a brand new trick. Hadn't done it in front of a huge audience yet, and I was like, I'm going to do it tonight. And still, I was experiencing some anxiety around it, even though I've been performing for years and like almost 30 years. I still had anxiety when it came to performing this new one, but I did it. And here's what happened. It failed miserably. I could not recover this, all right? So it looked terrible, it went terribly. But here's what I want you to understand. It didn't stop me. It didn't stop me from performing, getting up and doing it again and again and again. So what do you do? What can you do when you are in this position where you are just so scared and you're petrified? In fact, you're frozen with fear. Well, you always have a decision when it comes to doing this, okay? And the decision I had was not whether I was going to do it or not. The decision I had was, what was I going to focus on? So you see, when you focus on the worst case scenario, your body immediately starts releasing all those stress chemicals, right? They put you into fight or flight, and your body is saying, and your mind is saying, hey, look, we just got to get out of here. We've got to either be prepared to fight or get the heck out of here. It's not a time for problem solving. Those chemicals that are being released in your body, they make your heart pump faster. They make you know, it's adrenaline. You can feel shaky, right? Because you're not turning it off. And you're just sitting there with these chemicals coursing through your body. And so you feel the shakes, you feel like you have to go to the bathroom, some people throw up, right? And it's because you continue to focus on that worst case scenario of messing up. So what is there to do? So what there is to do is to focus on the other option. Because if you focus on the other option, which is going out and having a good time, performing well, the other option is connecting with your audience, having a meaningful connection, right? Having an authentic connection. The other option is feeling good. The other option is learning something from the performance. The other option is learning something from putting yourself out there and taking a risk. The other option is being able to feel courageous, because that's the gift of fear. You can only feel courageous when fear is present. So if you're feeling fearful, let yourself know, hey, this is my opportunity to step into courage and to continue to focus on the positive outcome and go forward. Is it going to be scary? Yeah, it's going to be scary. You learn to manage that fear. And then what happens as you do it over and over and over again, the fear is diminished. It may not ever go away, but it'll be diminished. And the more you focus on the positive outcome, the beautiful outcome, the more diminished that fear gets. And then an incredible thing happens. Then you become competent. You reach a level of competency which gives you a massive level of confidence. Okay? So that's what there is to do. I really want you to hear this, because you've got music in your heart and you want to share it with the world, then get out there and do it. Step into that. We need more music. We love music. We love to connect with artists who are vulnerable and sharing their story. So here's what there is for you to do. Focus on the positive outcome, get courageous, step into that courage and take action. And you might just even ask a couple friends or family members and let them know, like, hey, you know what? I'm dealing with this performance anxiety. I just want you to hang out right over there while I sing, while I play my instrument. Just read a book, do whatever, just be in the room while I begin practicing, and you can take little baby steps. All right, so Danny, thanks for reaching out. I really appreciate it. I know you can do this, and I believe in you. Everybody stick around, we're gonna be back with Amy. We're gonna talk about oral hygiene and what is the overreaching effect of oral hygiene on our overall health. Stay with us. Hey everybody, welcome back to Live It Up. We're here with Amy.
Hello.
Hello. Hey, you said earlier this week you wanted to talk about dental hygiene on the show, and I was a little surprised because I didn't know that you dealt that much with it, but you said there was some pretty cool information. You began to share about it. So
Why is it of interest to you?
Well, and I just want to say that I heard your intro and you kind of dissed my topic.
But I saved it, right?
You kind of, you made it sound interesting. I do realize that I find pretty much everything about the human body interesting. I remember one time I put this talk on at a community event about like women and cancer, and I just felt like everyone would come because they'd want to like hear about how to prevent it and what they're at risk for. Like no one really showed up, like maybe like 3 people, and someone gave me the feedback like, yeah, that topic didn't sound like very much fun. So I do tend to think everything's interesting about the body, but
yeah.
So there are several reasons, and I guess really what I mean is oral health, like the health of your mouth, not necessarily hygiene, but kind of one and the same. So one of the obvious things is that if you have poor dental health, it does impact the quality of your life. Having dental pain, if anyone's ever had dental pain, I haven't. But, it's some of the worst pain that people can have, and it doesn't really respond well to even pain medication. So it's very painful. And then the second thing is if people don't have teeth or they can't chew very well, then that really limits their ability to eat a healthy, balanced diet with lots of fruits and vegetables. But more importantly, there appears to be a link between poor oral health and a person's overall health, like you said.
So that's what's interesting to me. Like, what is that connection? Help us learn about that.
Yeah, so just like many areas of your body, maybe people don't want to think about this, but our body has a lot of bacteria on it and in any of the holes that we have in our body. And your mouth is one of those. It has a really heavy load of bacteria in your mouth. And most of these bacteria are healthy bacteria. I mean, you need them in there. They are the ones that it's very fascinating. Again, but maybe I'm dorky like that. But there's an interplay of these bacteria and the plaque on your teeth, and they all kind of support each other in this way, and saliva. And there's just like this whole ecosystem in your mouth that your body does a really good job at maintaining a certain pH, a certain moisture level, and a balance between the plaque and not having plaque. So your mouth is, along with having the bacteria, is the entry point into both your digestive tract, right? Because from the mouth, then you go down the esophagus to the stomach, and also from your mouth, you go down your trachea, your windpipe, into your lungs. So it's the entry point to your respiratory and digestive tract.
That's interesting. I never thought about that.
Yeah. So normally your body has a mechanism to keep the bacteria healthy and in balance, and keep everything under control. But if you don't take good care of your mouth, or if you have a issue that might make it difficult to have good oral health, then the bacteria might reach levels that can cause a problem in your mouth and therefore inflammation. There also are a lot of medications that can reduce the flow of saliva and cause a dry mouth. And not only is that uncomfortable, it makes it hard to eat, it makes it hard to talk, it makes it hard to sleep, but it also makes it hard for you to digest, because your mouth and your saliva is actually the first point of digestion, and along with what happens in the stomach and the rest of the digestive tract. But the saliva helps neutralize the acids and everything else in your mouth. I mean, your body is literally maintaining homeostasis all over, all the time.
Yeah, that's really interesting to consider that. It made me think of something. I don't know if you have the answer to this or not, but there's lots of people use mouthwash, and I think it says kills 99.9% of bacteria or whatever. Are we doing ourselves a disservice when we use that?
Well, yeah, I don't know the exact answer to that, except for the fact that I don't ever use that mouthwash. I've never been told to use that mouthwash. The only time that I know people use that mouthwash is if they have a certain type of infection. If they're told to use that mouthwash by their dentist or oral surgeon, there are times when you should be using that type of mouthwash, but usually my recommendation would be to only use that under the direction of someone who's taking care of your mouth because you need it for some reason.
Interesting. So I shouldn't necessarily just trust the commercials on television?
I know it's shocking. You probably shouldn't.
All right, cool. Well, anyways, I'd like to maybe hear from a dentist on that or something. That's because that makes me just think about. So you're talking still mostly about the mouth, but how does it affect the other areas of health? So can you give some really concrete examples?
Yeah, so studies suggest that oral bacteria and inflammation associated with gum disease may play a role in some of these diseases. And like we've talked about before, when you look at studies, there's a difference between causation and association. So these studies are mostly associations and not necessarily causation. So what we mean by that is we don't know if it's like exact, like, oh, you have this bacteria and therefore you have this issue, or is there something else at play with your overall health or something going on in your body?
Okay.
But to be more specifically, so endocarditis is a really serious infection that affects the valves of the heart. And so that typically occurs when a bacteria from other parts of your body get into your bloodstream and then hop onto your heart valve and cause growth and, bad infection. You usually need long-term antibiotics and replacement of that heart valve by surgery. So the mouth can be one of those areas that people get that into their bloodstream. So if you have really bad dental disease. So heart disease, although the connection is definitely not fully understood, like I said, it's mostly association, and we haven't really been able to find causation, but poor oral health has been associated with clogged arteries and stroke and heart disease, dementia and memory loss. So adults who have gingivitis, which are swollen gums, perform worse on tests than people that have healthier gums.
Whoa.
Pregnancy and childbirth complications, so periodontitis, which is infection or inflammation on the teeth, has been linked to premature birth and low birth rate.
Wild.
Certain bacteria can definitely cause, if you have poor oral health, it can cause certain types of pneumonia, because like you said, that's interesting to the lung. And then there's research that shows that people that have gum disease have a harder time controlling their blood sugars as well if they have diabetes.
Wow.
Yeah, those are just a few examples.
Yeah.
Yeah. Okay, so commercial break real quick, and we'll come back and get some more details.
Stay with us. Hey everybody, we are back. Welcome back to Live It Up. We're here with Amy. We're talking about oral hygiene and the connection to our overall health. And as you can, as you've been able to hear from her, there's a big connection. And so why would cardiovascular disease and poor oral health be connected?
Yeah, so again, we don't totally understand, but multiple studies have shown that people with poor oral health, meaning gum disease or losing teeth, have a higher rate of heart problems like heart attack or stroke, or blood vessel problems like heart attack and stroke, than people who have good oral health. And so there's a few theories that have been proposed, but nothing has been kind of nailed down yet. So one theory is that the same bacteria that can infect the gums can also travel in the blood vessels and actually cause inflammation. The bacteria itself causes inflammation and then causes the plaque and the buildup. And one of the reasons that they thought that is because they have found remnants of that type of oral bacteria in the plaques in the blood vessels. However, when they did studies where they looked at like giving people antibiotics to get rid of this type of bacteria, it didn't make a difference. So we don't really know exactly that theory. We're not sure. Another theory is that rather than the bacteria actually causing the problem in the blood vessels, it's the inflammation. It's your body's immune response to the like not normal bacterial makeup in your mouth. Your body has inflammation, and then inflammation, as we know, causes a whole cascade of problems, one of them being inflammation of the arteries. So that's one option, and that one seems maybe a little bit more likely. And then lastly, that maybe there's no direct connection between the actual oral health and the blood vessel disease, but what it is there's a third factor, meaning like people who don't take care of their mouth or don't have a good diet and therefore have worse oral health. Maybe that's what the problem is. Or if they're smokers, they then have poor oral health, and then that's the link. So we don't really know whether it's a causation or maybe a third factor.
Got it. Cool. All right.
So jury's still out. More studies are definitely being done.
Okay. So besides being painful, are any of the dental infections dangerous?
They definitely can be. So, I mean, the actual, like if you just have a tooth infection, no. But you can get, there's all these kind of planes in your neck in between the soft tissue. It's kind of hard to describe. But if infection gets down in there, it can be really serious. And dental decay, like a broken tooth or an infected tooth, is one of the major causes of infection of the deep space of the neck. There's actually, I always like to talk about cool names. There's one that's really that's really dangerous, and it's called Ludwig's, or probably Ludwig's angina. And it was first described in 1836. That's how it got its name, by a German physician whose last name was von Ludwig. And it was at that point rapidly and usually fatal infection of the neck leading to gangrene.
Yikes.
And so there could be like gas in, like you actually could feel air in the underneath the skin, and then it would cause everything to swell, your tongue to swell, your throat to swell, so you couldn't breathe and you die.
Oh,
So obviously
man.
it's super terrible.
Yeah.
I've seen it I've seen it several times in my
Wow.
career. Usually people have to be hospitalized, but I've not seen it be deadly because we have really good antibiotics. So before we had antibiotics, the reason that the word angina is used is because it comes from the Latin word, the root angere, which means to strangle. So basically people like
Yikes.
suffocated
Yeah.
to death. So it's super, antibiotics are wonderful. So again, if you had this, it would be quite obvious, but it would usually come from a tooth infection or an injury to the mouth. And then you would have, underneath your tongue, you'd have pain or swelling. You would have difficulty swallowing, even to the point of drooling. You would have fevers or chills, that kind of stuff. Obviously, if you thought you had that, you should go to the emergency room right away or call 911.
Got it.
But
Okay.
that's kind of a cool one called Ludwig's angina.
Yeah, wow. So are there any risk factors that make people more prone to having poor dentition?
Yeah, so yes, there are. So definitely some health issues and also some medications. So diabetes is one example. So the main link between diabetes and oral health risk would be high blood sugar. So if your blood sugars are poorly controlled, you're more likely to have that bacteria be out of whack and then therefore lead to dental decay. So there are some studies that show controlling blood sugars also leads to better oral health. And also you can have a dry mouth, which can lead to more problems. Medications can cause a lot of issues. So more than 400 medications have the possibility of causing a dry mouth. And like we said, the saliva cleans your mouth, it helps with digestion, it helps with so many things. When you don't have enough saliva, it actually leads to a lot of problems with your teeth and your gums.
Interesting.
Inflammation and mouth sores that can be caused most commonly with certain blood pressure medications. Medications that suppress your immune system, birth control pills. You can get enlarged gums from certain types of medications, even a really common blood pressure medication class called calcium channel blockers. Cavities, that's usually, you might be chewing on like Tums and you don't really notice that there's sugar in them or things, or if you did Halls all the time or something, there's sugar in those, so it can cause dental caries or cavities. Thrush can happen if you're on steroids or antibiotics for a long time or chemotherapy.
Got it. All right. So we only have a short amount of time left.
Yeah.
We got to hear about what there is to do. How do we prevent it?
And you definitely should have a dentist on for a lot of this. But
Yeah.
brushing your teeth twice a day is really huge. Not smoking or using chewing tobacco, obviously, that would lead to a healthier mouth. Avoiding high sugar foods. Making sure you eat a lot of crunchy raw vegetables and fruits because it actually cleans, gets rid of some of that plaque on your teeth just by doing that.
Interesting.
Using a soft toothbrush is better for your gums than a hard toothbrush. Seeing your dentist regularly, and if you have tooth pain, take it seriously. Go see your dentist right away and don't delay.
All right. Good
Yeah.
stuff.
Hey, thanks. It wasn't as boring as you thought it would be.
No, not at all.
That's good.
It was very interesting. Okay, well, it's time to get out there now. You know what to do. Get out there. Be a source of kindness. Be a source of contribution. You do have something to offer this world, and we believe in you.